Thank you so much for this recognition. I'm deeply honored by this award and humbled to be amongst the august list of prior awardees. We all, I believe, share a commitment to innovative discovery science that enhances the lives of patients and public health impact. It is particularly humbling in so far as it recognizes a motivation that I've had throughout my life and career that was instilled in me by my parents to really care for your neighbors and to seek to help others, and important as a physician scientist to relieve suffering. And it's really that motivation of compassion and scientific curiosity that leads to enhancing our ability to care for our patients that motivates me as a physician scientist, and the desire to take what we know, advance it through discovery science such that we can continually enhance our ability to relieve suffering and enhance the health. Moreover, I'm particularly motivated to ensure that our discovery science not only solves intellectual problems, but enhances the lives of everyone in all communities, is therefore inclusive of all communities. Indeed, many of the communities that are most vulnerable and disproportionately burdened by disease need our scientific discoveries the most, not only in this country, but around the world. And indeed, this is part of my motivation to not only move as a physician scientist seeking to understand the molecular basis of disease on an individual basis, to my current role as director of the National Heart, Lung, and Blood Institute, to do that at scale in a way that it takes discovery science to enhance the lives of everyone in all communities in a way that enhances health equity. Indeed, as we look to the future, that motivation continues and gives me great excitement because I see incredible opportunities. Certainly as cardiovascular scientists and cardiologists, I use cardiovascular disease as my paradigm. And looking back at the beginning of my career and how we treated heart disease, recognizing that most of the things we did when we were residents and fellows, we don't do anymore because we found out there are better ways to treat folks, and a lot of the things we were doing actually was creating harm more than good. But that's the beauty of discovery science, and that's what gives me hope and optimism. And indeed, we're excited by the new tools and technologies that come from genomics and the capacity to do gene editing and gene therapy, leveraging data science, artificial intelligence to discover the molecular networks underpinning, we hope, all diseases in ways that can identify novel targets that, again, can do more than just control chronic diseases, but perhaps can preempt and promote the regression of cardiovascular disease in the future. Indeed, these aren't really science fiction, to the degree which our institute 7 years ago set out to promote a cure for sickle cell disease by the 75th anniversary of its discovery as a molecular disorder in 1948. Indeed, at the 75th anniversary, 2 FDA-approved treatments for sickle cell disease that have been transformative for patients using these new tools and technologies. And indeed, we're looking to the next generation of in vivo cellular engineering and gene modifications that indeed may find a lifelong treatment of high cholesterol that changes the whole trajectory by leveraging genetics of PCSK9 and tools to make genetic modifications in ways that can lower cholesterol over the life course. And new genomic technologies and prognostic tools that will enable us to intervene much earlier in the disease, indeed change the whole life course, indeed maybe even preempt the disease. That's what gives me great hope about our future and our optimism about our ability to continue to innovate with discovery science that enhances the lives of everyone and in all communities. So again, thank you so very much for this recognition that, again, I couldn't have achieved without many others who we worked with in our teams and were mentored by, and that we hope will continue to advance science. Thank you again.